This is the introduction to the BEH 101 video for handover and communication. The student featuring in this video is Elsa Lynn, and this is what she looks like. The date of this presentation is the 26th of May 2013. The purpose of this video is to demonstrate a face-to-face handover of a patient to a senior clinician, and also to demonstrate verbal hospital notification via radio.
Hi Cam, I'm Elsa, this is my partner Greg, and this here is Adam Jones. Adam Jones is 45 years old, he has no known allergies, no current medication, and he has a patient history of untreated diabetes. What happened here today is that Adam Jones was seen falling unconscious whilst up in a cherry picker prior to falling approximately 3 meters to the ground. Witnesses report seeing his left lower leg buckle below him as he made impact with the ground. He then remained unconscious on the ground for a further 3 minutes before being taken to the first aid room where Greg and myself found him. Adam Jones says that last night he got out of the shower and passed out, and for the last couple of days he's been suffering with a little bit of a cold. He is now complaining of a shortness of breath. Upon my examinations, I suspect that Adam Jones has fractured his left ankle because you can see significant swelling and bruising and deformation in that area. On my other examinations, I found that Adam Jones has restricted air entry into the left lung. This began with nil air entry into the basis level of his left lung, but since Greg and I have been here, it has risen to include both the basis and the mid-zone of his left lung. His right lung has perfectly good air entry and is breathing fine. There's significant bruising on Mr. Jones's left chest, and there's also some subcutaneous emphysema there. Our last vital signs of Mr. Jones have found that he is hypertensive. He has a blood pressure of 90/60. He has oxygen saturation levels of 85%, which have decreased from our initial readings of 88%. He has a heart rate of 126 beats per minute. He has a decreasing conscious state. When we first arrived, it was a Glasgow Coma score of 14. It has since decreased to 13. And Mr. Jones is also complaining of a pain scale of 6 out of 10.
Good afternoon, it's the Morty Alec crew here, coming to you with a 45-year-old male, no allergies, no medication, and has a patient history of untreated diabetes. Patient was reportedly seen becoming unconscious whilst up in a cherry picker prior to falling approximately 3 meters to the ground, where he remained unconscious for a further 3 minutes. Patient is presenting with query, tension pneumothorax, and a fractured left ankle. Patient has decreased air entry into the left mid-zones. Patient is tachypoetic at 28. Patient has a decreasing GCS score of 14 down to 13. Patient has a heart rate of 24, sinus tachycardia, and patient is hypertensive at 90/60. Patient is Pearl, and patient has been treated with 10 milligrams of IV morphine and 500 milliliters of normal saline. Patient has been spinally immobilized. We are en route, ETA 15 minutes. See you soon.